Can folks hear me now? Ah, there we go. Okay, wonderful. Hi everyone. Welcome to today's session on methane mitigation and health. Really nice to have you all here with us today. I'm Jenny Miller. I'm the Executive Director of the Global Climate and Health Alliance, and I'm going to be moderating this session. We got involved, the Global Climate and Health Alliance got involved in working on methane because we came to realize that without mitigating methane, we won't be able to keep climate change and global warming within the limits that are healthy and relatively safe for human beings. But then also as we got into it, we learned that many of the strategies for mitigating methane actually have health co-benefits. So above and beyond the benefit of limiting global warming. But as we got into this, we realized that we need to become more informed about those intersections ourselves, and also that the health community in general, we felt, just needed some grounding in that intersection of methane and health. And so the first thing we did when we took on this project of looking at methane and health was to develop a set of reports that looked exactly at that intersection. And we collaborated with Apt Associates to develop a set of 3 reports and an overview. So the overview looks at methane and its role in climate change. And then there are reports for each of the 3 main sectors that drive methane emissions, and that's the energy sector, the food sector, and the waste sector. So today's session is going to look at all of those things. First, why methane is so important to the fight against climate change and protecting people's health. And then we're going to also hear from speakers that speak to each of those sectoral perspectives on methane. So we will also in the session have a little bit of interactivity. We have I don't know if anybody has used Slido before, but you can, we'll have a QR code that comes up at a certain point. You can pull up Slido on your phone and then respond to a question and then also enter questions for our speakers that way. That'll come up a little bit later in the session, and that will give us some opportunity for some Q&A with our speakers. So think about questions that you have for them as they're in the process of speaking. Before we hear from our speakers, I'd like to just go through and introduce them all. We have over here to my right, to your left, Manjot Ahluwalia from the Global Methane Hub. We have Vivian Mandueke from the Global Alliance for the Future of Food. In the middle here, we have Gayatri Nair from the Global Alliance for Incinerator Alternatives. And we'll also hear online from Leanne Hill from PSE Healthy Energy. I already introduced myself, but you'll also be hearing from Amanda Quintano from Apt Associates at certain parts in the program. And again, before we dive in, I just would like to acknowledge the co-hosts of this session. So this session was put together by the Global Climate and Health Alliance, Apt Associates, the Global Alliance for Incinerator Alternatives, the Wellcome Trust, the World Resources Institute, and the Environmental Defense Fund. Okay, without further ado then, I would like to turn over to Manjot to talk to us about why methane matters so much.
Thank you so much, Jenny, for this introduction, and thank you to the event hosts and all the co-hosts that are making this event possible. My name is Manjot Ahluwalia. I'm the regional lead for the Global Methane Hub, and in a second I'll tell you a little bit about the hub. But first of all, what an honor to be speaking to you all about this topic in this WHO pavilion among all the health and the policy practitioners we have in the room. So, Jenny, you asked me about why methane. So I want to first dig into the science. And please, apologies, because I'm going to refer to my notes since I just want to make sure I get the right facts across. So according to WHO, 9 out of 10, which is 99% of the people, live in areas where air pollution is exceeding the WHO global air quality guidelines. And we know that exposure to ambient and household air pollution is responsible for 7 million deaths. And methane is the primary contributor to the formation of ground-level ozone, which is a hazardous air pollutant and a greenhouse gas, exposure to which causes 1 million premature deaths every year. Methane is also a powerful short-lived climate pollutant, or an SLCP, and over a 20-year period, it is 80 times more potent than CO2. So compared to CO2, actually methane only takes a decade to break down. And what that means is that reducing methane emissions now, we would have an impact in the near term. And it is the strongest lever we can pull today, of course, along with decarbonization, to stay within the 1.5C guardrail that you just started us off with. And that's why the Global Methane Hub was created. And it is a philanthropic fund launched on the heels of COP26 in Glasgow. And it's the first coordinated approach to tackle methane emissions through catalytic investments across the 3 sectors that Jenny noted for us: agriculture, energy, and waste for methane mitigation. And I would also like to note that the catalytic investments we make, we want to make sure we are aligned with the science, which is we want to reduce methane 45% by 2030. And as we are doing that, it needs to deliver the core benefits of health, livelihoods, nutrition, productivity, dignity for all our communities around the world, especially for the Global South. And according to current data, some quick wins are actually already possible in the energy sector, but waste and ag has been slightly challenging. So just to put in perspective, research shows that 41 to 47% emission reductions are technically feasible by 2030, and more significant reductions are possible in the energy sector, oil and gas and coal, for example, then followed by waste and agriculture. So only a fraction of mitigation, which is 2% in agriculture, is currently cost effective, which means we need to work definitely in this segment. And so what GMH is doing, and we have also announced this at COP, is that we've created an enteric fermentation accelerator for 200 million to support the breakthroughs in R&D from the livestock sector to help with methane mitigation rapidly, especially in the low and middle income countries, which also brings direct benefits to farmers in terms of livelihoods and resilience to climate change. We are also increasing our investments to enhance the link between climate, health, and air pollution, the topic that we are discussing today. And we have a long-standing work with CCAC, the Climate and Clean Air Coalition, and also supporting your work with the Global Climate and Health Alliance. And as you noted, you've clearly articulated the opportunities for methane mitigation along with APT in the room across the 3 sectors. So I really encourage you to take a look at those reports. And of course, we must also pause and applaud WHO and COP28 presidency and all the partners who have come together for the Climate and Health Day and the declaration endorsed by over 120 countries, making it a first in the government's acknowledgement of the growing health impacts of climate change on the communities and countries, including climate-related health impacts such as extreme heat, air pollution, and infectious diseases. So what it does is it actually creates an opening for our work, the work we can do with climate and health, get the practitioners involved, get the health community, get the health ministries involved in this work. Another win for us at COP was that at day 3, the US, UAE, and China called on all parties to the Paris Agreement to submit the next round of climate targets, the NDCs, for 2035 that are economy-wide and cover all GHGs, which means in everything, including CO2, which is significant because, as one of my colleagues from Clean Air Fund noted, it will prod countries to start measuring and accounting for climate footprints of pollutants such as black carbon and methane, and probably as a community, we can start holding them more accountable. So on the road to COP30 in Brazil, we look forward to working with our existing partners and also engaging deeply with WHO, which is actually already activating health ministries and other relevant line ministries to get methane and health targets in those climate targets, but also for us to put the climate finance to make those targets a reality. So I'll just conclude by saying that by addressing methane emissions, we really have this rare opportunity within our lifetimes to really avert the climate crisis, but do so keeping in mind the health and well-being of our planet, people, and future generations. So thank you again, and I look forward to today's conversation.
Wonderful, thank you, Manjot. And a good starting point to kind of lay out the overarching picture. So coming up next, we have a very short little video that GCHA put together to try to capture in a really accessible way what are those intersections between mitigating methane and health. And what are those impacts of methane from a global climate change point of view? So at this point, we'd like to run that video.
We're busy people, but we need to talk. Methane! Yes, the gas. Yes, that gas. And its role in the biggest threat to public health, climate change. While carbon dioxide gets all the blame for packing heat, methane is a close rival. Though dwarfed by the amount of CO2, it's 80 times more powerful, behind 30% of our climate woes. Not only that, but the inhalation of methane's toxic co-pollutants and the ozone it helps produce keeps us even busier. While CO2 stays in the atmosphere for centuries, methane only lasts around a decade. But methane emissions are growing, double pre-industrial concentrations. Even if we stopped all CO2 production today, methane emissions would still mean we pass 1.5 degrees warming, and we think we're busy now. So where does this methane come from? Livestock, manure, and bad land management create huge amounts of methane, as do landfill sites where our waste rots. And significantly, fossil fuel production releases massive methane emissions. So how do we get off our gases? Firstly, the easy fixes, like getting fossil fuel companies to stop leakage, then replacing coal, oil, and gas with renewable energy, moving to low-meat, plant-rich diets, and using food and agri-waste as compost as part of a circular economy. All this could reduce human-caused methane by up to 45% within the next decade and avert 0.3 degrees Celsius of temperature rise by 2045, giving the world a little more breathing space, better health, and a first easy win against climate change. Leaving us a little less busy.
Okay, Amanda, over to you for Slido.
Thank you. So for everyone watching online and also in the room, you can scan the QR code on the screen that you're seeing, and you'll be taken to a poll. And this first poll that we have is just asking you what words jump out at you when you think about methane and health. Now that you've heard the introduction and you've seen this short video, if you can type a word or two, a phrase that jumps out at you and fill in the word cloud that we'll be sharing on the screen shortly. If we can switch to the Zoom. So we're seeing live on the screen now the words that are jumping out at people. And number one here now is ozone. Fossil fuels, risk. We have toxic, circularity, leaks, agriculture, respiration, invisible, which is a Really important one I think we'll talk about with our sector speakers. Livestock, opportunity. Obviously, fossil fuels and livestock seem to be two really popular words. So Vivian, we'll hear a lot about this in your presentation, I'm sure. Great. Respiratory illness, respiration, air quality. And I think that's all. We'll turn it back over to you, Jenny. Thanks.
Great. Thanks, Amanda. Good start. So our first sectoral speaker is not with us here at COP in person. She's dialing in, I believe it's maybe 3 in the morning. So she was very keen to make this presentation. She would have loved to be here in person, but the Blue Zone badges did not permit that to happen. So over to Leanne Hill from PSE Healthy Energy. Leanne, you're on.
Thank you so much, Jenny. Give me one moment to share my screen. Can folks see my slides?
Yes.
Great. So as Jenny mentioned, my name is Leanne Hill, and I'm the Director of Energy and Health at PSE Healthy Energy, where I lead impact-focused research on the relationship between energy, climate, and public health. And for those that may not be familiar, PSC is a nonprofit energy science and policy research institute that studies the ways that energy production and use impact public health and the environment. We have a team of public health professionals like myself, scientists, engineers based across the United States that integrate multidisciplinary expertise to inform science-based energy policy. And we ensure that science addresses real-world challenges through actionable research, strategic communications, and advising. I am incredibly grateful for this opportunity to join you virtually today from the US to discuss methane emissions from fossil-based energy in the context of public health. Globally, the International Energy Agency, or IEA, reports that the energy sector is responsible for roughly 40% of total anthropogenic methane emissions. And with that, fossil fuels, coal, oil, and natural gas are the primary source of energy-based methane emissions. Just last year, global energy industries emitted 135 million tons of methane, further indicating the critical need to reduce methane emissions from the energy sector in the near term. And while tackling methane emissions is a critical climate priority, cutting these emissions is also essential for protecting public health. At the global scale, mitigating methane can help reduce the direct and indirect public health and safety impacts associated with climate change. And at the local level, energy system components from a wellhead in a community to a gas appliance in the home serve as key sources of methane emissions and direct emissions of health-damaging co-pollutants that contribute to cumulative exposures over an individual's lifetime and the cumulative burdens faced by communities. As a society, we largely evaluate climate and public health in separate contexts. And we see this in energy-focused research, which overwhelmingly evaluates methane and health-damaging air pollutants as separate research topics. We also see this often in climate policy, which can focus on limiting the total amount of methane, but may not necessarily aim to evaluate or address co-emitted health-damaging air pollutants and the risks they pose to public health. At PSE, we're working to bridge this gap in understanding by leading research to inform solutions that protect both our climate and public health. And so diving right in, we began our research with a very fundamental question: what is natural gas? Natural gas leaks throughout the oil and gas supply chain inherently include methane. It's the primary component of natural gas. But these leaks also include various health-damaging air pollutants, often hydrocarbons, that are naturally occurring in oil and gas reservoirs. These co-emitted pollutants include benzene, a known human carcinogen, and other pollutants for which exposure at very low concentrations is associated with increased risk of adverse health effects. And notably, many of these compounds are precursors for other health-damaging air pollutants, like particulate matter and ozone, that result from secondary formation in the atmosphere. Our ongoing research, including primary or field-based data collection and secondary data review efforts over the last few years, have recently focused on characterizing natural gas composition. And understanding both the methane and the health-damaging air pollutant fractions of natural gas can help us evaluate the air quality and public health benefits of decarbonization and methane mitigation efforts throughout the oil and gas supply chain, from the wellhead and into the home. Methane emissions in the upstream can stem from intentional releases from venting or blowdowns during production or processing activities, and also from unintentional leaks from various infrastructure components, including but not limited to wellheads, pneumatic controllers, and storage tanks. By testing leak gas directly from abandoned wells and from an ongoing review of facility air permits, our research has shown that upstream gas contains benzene and other health-damaging air pollutants, emphasizing the health relevance of these leaks, especially when upstream infrastructure is located near populations. Leaks can also stem from transmission infrastructure, and our recent review of measurements from U.S. interstate pipelines found health-damaging air pollutants were frequently reported in pipeline gas. And our downstream research largely focuses on the indoor environment, given that leaks from end-use gas appliances can impact indoor air quality, leading to heightened exposures to air pollutants and increased associated health risks. Our published and ongoing research in the downstream includes sampling gas from kitchen stoves in 9 states in the US and in 4 additional countries and counting internationally. And we've identified health-damaging air pollutants in natural gas sampled directly from residential gas stoves. We've modeled indoor air quality impacts of gas stove leaks, and in some cases found indoor benzene concentrations that are comparable to secondhand smoke. In collaboration with Stanford University, we found gas combustion resulted in indoor benzene levels that exceeded chronic health benchmarks. And we've examined the available literature and found that sulfur-based odorants that are added to distribution natural gas can induce a range of acute health symptoms. And through our research, focusing throughout the oil and gas supply chain, we have compiled an ever-expanding database on natural gas composition. So outlined in the schematic here on the left, we are currently integrating these data with methane emissions measurements provided by external partners, including aircraft and soon-to-be satellite methane measurement campaigns. Armed with detailed information on both methane and the health-damaging air pollutant fraction of natural gas, we can then model air quality impacts and estimate safety and health risks of specific oil and gas leaks. And we're currently developing an interactive tool that will place these oil and gas sector leaks in an air quality and public health context. Using this tool, we hope communities, regulators, and other decision makers can better understand, effectively mitigate, and rapidly respond to oil and gas sector leaks. Tackling methane emissions from the energy sector represents one of the best near opportunities for limiting warming, as we heard earlier today. According to the International Energy Agency, methane mitigation strategies can often rely on existing technologies and approaches like leak detection and repair, improved technology standards, and bans on emergency flaring and venting. And these strategies can also often be cost effective. And from our research throughout the supply chain, we know that natural gas leaks include methane and health-damaging air pollutants. And therefore, targeted measures to reduce methane will also lead to reductions in other air pollutants. With all of the ample global efforts underway to identify leaks and quantify methane emissions from the energy sector, integrating data on the health-damaging air pollutant fraction of these leaks will be critical to evaluate and maximize the health protections provided by methane mitigation policies. And of course, coupled with broader swift and strategic efforts to decarbonize, targeted methane mitigation efforts should focus on super emitters or sources with large magnitudes of emissions. They should consider proximity of identified methane sources to nearby populations and prioritize emissions reductions in overburdened communities. All in all, ensuring that climate-focused methane mitigation policies are also targeted to be health protective can also increase the broader societal benefit of these policies. And with that, I want to thank all of the event organizers and co-hosts today for this opportunity to share on this very important topic. Thank you.
Fantastic. Thank you so much, Leanne. And just to kind of pull out a couple key points there, one of the key points to draw out from Leanne's remarks is that there are relatively easy near-term things that can be done to reduce leaks from existing fossil fuel production that would have immense co-benefits from health by reducing the air pollution that's produced and reducing the co-pollutants, the highly toxic co-pollutants that are emitted. So we'll have an opportunity to ask questions later, but I just wanted to highlight that one key point. Okay, I want to turn back to Amanda now to tell us how to post your questions via Slido.
Okay, so if we can bring the Slido QR code back on the screen. You might still have it on your phones, and if that's the case, then I will just pull up the next set of questions, which is an open-ended question for the speakers. As you hearing these presentations, maybe you have a question that comes to mind, feel free to type it into the Slido chat, and we can ask them during the live interactive Q&A. Thanks.
Thanks, Amanda. So just as you go along, if you have questions that come up based on things that the speakers are saying or other things that you know about, just type them in to the Slido, and when we have Q&A, we'll be able to take on some of those questions. Okay, now it's my pleasure to turn over to Vivian Madueke from the Global Alliance for the Future of Food to talk about methane emission and the food sector and the relationship of those things to health. Vivian, over to you.
Thank you, Jenny. Hi, everybody. I have a few slides to share, but whilst we bring that up, I work with an organization called the Global Alliance for the Future of Food. And we are a strategic alliance of philanthropic foundations working together to transform food systems. And the topic I'm going to talk about is the relationship between methane, food, and health. Is this working? Can we get this to work, please? Just help me move it. It's fine. So in the next few minutes, I'm going to talk about how food connects with not just methane, but also fossil fuels, like our colleague initially shared, how much fossil fuels and energy is contributing to food. Is contributing to methane. Next slide, please. That's okay. Don't worry. Thank you for your patience. It's going to be worth it. Okay. Next slide, please. Next slide. If it's not coming up, I can continue speaking. Anyway, agriculture contributes more than 42% of the total methane emissions. That means it's one of the highest, not even is one of, is the highest emitter of methane today. And there are 4 key ways that this happens. The first one is what we call enteric fermentation. And that is where you have a lot of the ruminants, like cows, as they eat, their digestion, their respiration emits methane. Also, we have methane in agriculture and food coming from manure. So a lot of the gases are produced from the manure, from the animals. We also have methane coming from rice cultivation. And then we also have methane coming from waste. So when you have your waste, your wasted food, it deteriorates and emits methane. Now, what is also important, if you look at the graph here on the right, you would see that beside agriculture is energy or fossil fuels. Now, I'm bringing this up because food is not only contributing directly to methane, but actually food is contributing to 15% of total global fossil fuel use. So food systems is both a culprit when it comes to direct methane emissions, but also it contributes to actual methane emissions from fossil fuels, 15% of that. So what this means is that food and energy systems are quite intertwined, and you can't transform food systems without talking about phasing out fossil fuels and vice versa. You can't phase out fossil fuels without dealing with the 15% coming from food systems. And I'm going to talk about how this 15% is playing out. Now you can see that currently our industrial food system is significantly energy intensive, and this energy intensity is growing for many reasons. It's growing because of growing mechanization, it's growing because of excessive processing. Now bear in mind I use the word excessive processing. The problem is not the processing of food, the problem is the ultra processing of food, where we extract the ingredients, put them back, and the more we do that, the more energy we're using, the more fossil fuels we are using. And like I said, I'm going to talk about that a little bit more. We also know that beyond food systems contributing to 15% of fossil fuels, food system also generates energy. Biomethane is one of it. I don't know if many of you know that you can have biodigesters that utilize biomethane to generate energy. Now, that is a potential solution. However, the downside of that is it can, for unintentional reasons, lock in the livestock situation and lock in the food loss and waste situation. So just bear in mind that food doesn't just consume energy, it also generates energy in form of biomethane and biogas. And another aspect that I want us to pay attention to is that the fossil fuel industry, I know some of you will be asking, you're here to talk about methane and agriculture and you still keep talking about fossil fuels. It's important because everything is linked. You can't decouple and say, oh, food and methane, food and fossil fuels. I'm trying to explain to us how all these systems are connected. So the current fossil fuel industry, what we are seeing is that they know that we are coming after them and they're looking for diversified markets in order to entrench the fossil fuel sector. And what they are doing is now divesting into petrochemicals. So we push them away from fuels and they move into petrochemicals. And a lot of these petrochemicals are used in the agricultural sector in form of pesticides, in form of fertilizers. So all of us need to unite, both those working on fossil fuels, those working on methane. We need to unite because it's one and the same thing. We can't decouple it. Next slide, please. Next slide. The one before that. Like I said, I promised you I was going to tell you why our food system is currently consuming 15% of total fossil fuels. And please pay attention, it's also connected to the methane. Remember I said methane in agriculture comes from livestock, it comes from manure, it comes from rice, and it also comes from waste. So our energy intensity is growing because of, first, increased mechanization, which means we're using more energy, more engines, and we need to transition that. The second one is the growing use of fossil fuel-based inputs. I talked about the fertilizers, the pesticides, and then globalized supply chains. For each time you fly food from Brazil to the US, you're using more fossil fuels. Another interesting part, which I'm sure a lot of the methane advocates here will agree with me, is the growing demand for meat and dairy. And that in itself is driving significant consumption and production of livestock. We also have the growing sales of ultra-processed foods. Like I said, the more you process food, the more energy you utilize. New food trends such as alternative meats, quite a controversial topic, also an opportunity to reduce methane. However, that's where we need a lot of R&D because at the moment, the energy intensity of the alternative meats could potentially negate the gains that we have when we transition. So there is need for more research and development to see how we can reduce the general energy intensity of the alternative products. As well, I've talked about the vested interest. I want to go back to the alternative meats piece. Now, for us as the Global Alliance, what we are promoting is more plant-rich diets that are minimally processed, which means if our alternatives are more processed and ultra-processed, then we need to think about what we are promoting to make sure that we're not solving a climate issue and then generating a nutrition issue and an energy issue. So let's make sure that our solutions are balanced and give us win-wins across. Next slide, please, before I go to my final slide. So we published a report which you can look at. Go to the Global Alliance for the Future of Foods website. What the slide is showing us is how the positive and negative interactions between food and energy, and methane comes in here. Now, if you look at the right, it's quite tiny. We looked at biogas production. Like I mentioned, there are a lot of solutions around trapping biogas, biomethane, and using that to generate energy. It has a positive outcome in the sense that we get to trap a lot of the methane and use it for energy. But the negative side of things is we are locking in livestock, because bear in mind that if you build a biodigester or if you build an equipment that uses livestock manure to produce energy, you're locking in a system because you need to constantly feed manure into that system. So that's in this report, we're trying to bring to light some of the unintended consequences that might come up with our solutions. The very last slide. So I've talked about all the interactions. Now, where do we go from here? What are the solutions already available for us at the moment? The first one is we need to promote sustainable just food transitions that support, like I said, plant-rich diets. That's the word here. We have the legumes, we have the beans, we have other plant-rich diets that we should be promoting today, and minimally processed foods, less and better meat. We're already consuming way too much. And I need to add a caveat to that. There are settings that are not consuming enough. So we need to apply the just transition lens to it, less in areas that are consuming way too much, and to some extent, encouraging consumption in places that are not consuming enough. Making sure that when they get to the higher income band, they don't start over-consuming. So we need to be mindful of that. The next one is phasing out fossil fuel agrochemicals. At the moment, like I said, we are locking in system, we are locking in fossil fuel use in agriculture. And one way to get a quick win is to shift from the use of agrochemicals towards regenerative and agroecological practices. We need to review policies around biogas. We're seeing a lot of trends in Europe, in US, providing subsidies towards biogas. That could have unintended consequences because it will lock in livestock, which produces 42%, produces air pollution, and that's something we want to be mindful about. And then shifting to renewables, because that's one way of reducing reliance on fossil fuels, renewables for cooling, for heating, for processing in the food sector. Another important aspect is we should be mindful of the corporate consolidation in the food sector, but also in the fossil fuel sector, because that is one of the reasons why we're having profits ahead of public health. So we need to make sure that in our advocacy that we're looking at the corporate consolidation happening, because they are simply shifting from fuels towards petrochemicals. And finally, ensure that all the solutions we are promoting truly promotes just transition. Why do I say this? Especially when it comes to livestock transition. There are a lot of amazing solutions. We have, the feedlots, using asparagopsis. Asparagopsis is, I believe, it's a type of seaweed where you can feed the cows and they produce less methane. We have alternative proteins. These are all various solutions that are being promoted. Let's be mindful that it truly allows just transition. It doesn't empower corporations ahead of rural livelihoods. I'll leave it at this, but thank you so much.
Thank you so much, Vivian. Great overview of the intersections there, and kind of an inspiration to think about what we need to take on to make this transition. So a reminder that if you'd like to ask questions of the speakers, you can use the QR code to get into Slido and then type in your questions as we go. So our final speaker is Gayatri Nair from the Global Alliance for Incineration Alternatives, and she's going to talk to us about methane and health in the waste sector. Over to you, Gayatri.
Good afternoon, everyone. Thank you for this amazing platform. We have all gathered here to, see the connection between methane and waste. And I'm here not to explain what methane is or how is it generated, what is the problems that it can cause in the environment or the contribution it has in climate change, but I'm here to give you a gist of how we dealt with it, how we dealt with methane emission and how we dealt with the issue of public health. Now, that is putting in front of you some solutions. To start with, let me give you a glimpse of my city. Its geography and demography. I'm coming from a city of Trivandrum, which is a capital city of the state of Kerala in South India. And the population of this particular city, being the capital city, is more than 1 million. And the area is just close to 200 square kilometer. And therefore, the density of population is 4,500 per square kilometer. And being a capital city, there is a floating population of 200,000 people per day. Now, you can just imagine the amount of waste being generated in this particular city. It is 423 tons per day, and out of which 72% is organic waste, which comes about 300 tons per day. And I emphasize on organic waste because you know where methane comes from. And until 2011, we had no issues with this, and we were going easily. But in 2011, there was a lot of public agitation. There was local level resistance because until 2011, we had a centralized plant. And the people living nearby the plant was in the outskirts of the city, and the people living nearby the plant raised this agitation, and we had to shut it down. So what next? What to do with this 400 tons waste per day? We didn't know. And we found a solution in moving towards decentralized waste management system. And let's now see how this contributed to methane mitigation and improved public health. And before that, I just want to let you know that I'm not a public health expert. I am an elected representative from South India. Youngest, I may not look young, but youngest, one of the youngest elected representatives. But even though I'm not a good expert in public health, I can give you some, insights into what all factors can contribute towards ensuring methane mitigation. Now, in India or in anywhere in the Asian region, more than 50 to 70% of the total waste generated is organic waste. We usually take it to landfills. I suppose it goes to landfills in your places as well. In Asia, we can't actually call a landfill because it's mostly not engineered or not as planned as it should be. They're just dump yards. So we know the picture is not so different in outside Asia as well. Now, the municipal organic waste dumps contribute to a good share of anthropogenic methane that our first speaker was talking about. The strong odor emitting from the dump sites due to ammonia and hydrogen sulfide gases is an index of large quantity of methane formation at surface level. The surface level methane just then contribute towards fire that from the dump yards, where in the middle of the dump yard you get plastic cotton between and the plastic traps heat. So this fuels the fire, and this is a common scene in Asia. So unfortunately, the problem of surface level ozone, which is a dangerous fact, is often ignored in many places, in many cities, particularly in India. Now, Kerala is in the west coast of India, the southwest, with frequent rainfall and high humidity, which is quite conducive for anaerobic digestion of organic waste. And most of you here will know more than me how the smoke, the odor from the waste, etc., pollutes the environment. There is depletion of air quality, there's depletion of soil quality as well. So what can be done about it is the question. And we faced the same question, and here's what we did. In the whole of the state of Kerala, mainly in the city of Trivandrum, we ensure that the organic waste produced, especially from households, do not end up in waste yards or waste dump yards or the landfills. There is source level segregation, and organic waste is treated in composting facilities that the municipality provides to each household, that like the bins you see on the screen, the green bins, those are called kitchen bins, that is placed in every house so that, that thing act as a composting unit in every house. So we don't need a landfill or a centralized plant as such. And we also have community level aerobic composting units that you can see the white pink bars over there. Those are community level units. So all the organic waste get composted here, more than 70% in the houses and the rest 30% in the community level unit. So we don't have to take them to landfills or anywhere else. And the compost can also be then used for kitchen gardens or terrace gardens. Thus ensuring the forward linkage of urban gardening. Now, what this contributes to is ensuring the soil carbon is secured, and good soil carbon implies soil fertility. Soil fertility comes to healthy plants and what she said, healthy food. So in that way, we have contributed a lot to public health. And one of our major campaigns in this process was regarding liquid waste as well. So we took up a campaign saying liquid waste is because of solid waste. And this campaign helped us to educate people to manage solid waste responsibly, to avoid it getting mixed with water or water sources. Now, along with this, so we have a community level action going on. And along with this, we have strong enforcement team with the municipality or with the local government. We have a team of 250 health inspectors with the uniforms. They have a day and night squad every day with zero tolerance towards littering or waste dumps. So if you spot someone throwing a bag or keeping a bag at least on the public roads, you get fined for that, like how you do that in Dubai. So that system works even in Trivandrum. So this I mentioned because we have to know that on the one side we have a proper control system, enforcement system from the government side, and on the other hand we have community level, local level action from the people's side, which force them towards behavioral change, which is something we are all forced to due to climate change. So climate change, we need behavioral change. So that thing is happening, and some of you here might have heard about Kerala's immense work during the COVID period. We had a very healthy practice during COVID, and the health indicators in the state is also very very good with highest HDI ranking in India. This is due to often the state of Kerala is being compared to developed countries, not compared to the states in India, but with other countries as well. Now, this is due to the policies treating public health as a public good. So there's this welfare-oriented action from the government side, and along with treating public health as a public good, we also require very good and systematic solid waste management to ensure a healthy environment and a sustainable future. Now, we can see, I am here as part of the Gaia delegation, and Gaia has recently published the EJ principles, the environmental justice principles. So I think, every country, for that matter, can go through the environmental justice principles and see how this model or the models that we see in some of the locally led, by some of the locally led organizations or, maybe even governments, can be replicated in other parts or even in the places that you all are living. You can even replicate these models and see how much you're contributing towards the EJ principles, which talks about respecting planetary boundaries, respect for waste pickers, just transition, inclusivity, local knowledge, incorporating local knowledge towards this work. All these can be, analyzed and put to work in the ground in your own cities or places you're coming from. And I think that is all that I have got to talk to you about. And thank you for listening. Thank you for your patience. And you all are welcome to visit our city anytime when you come down to India. Thank you.
So Gayatri, you started your talk by saying that you're not a public health professional, but I think your talk actually illustrated that government, people in government actually are public health professionals because the work that you do helps deliver that public health. So, okay, at this point, I'm gonna turn back to Amanda, and Amanda is going to take questions from the audience and pose them to our speakers.
So as we were hearing our wonderful presentations from each of our sector representatives, we've gotten lots of questions from the audience here in the room, but also online. So I just want to field a few questions to each of the speakers, if that's all right. I'll give you a moment to think about it. Once I give you the questions, you can write some notes, and then we'll go in an order of answering. Great. So to start, I will start with Leanne. So Leanne, the first question that I have for you is, how can we integrate data on health-damaging air pollutants across the natural gas supply chain, emphasizing the need for climate-focused energy policies that also prioritize public health for maximum overall benefits? And the second question to you is, how effective is public regulation in avoiding methane emissions from abandoned oil fields? It's a very targeted question. And to our speakers in the room. So first to Vivian, should our priority be shifting towards plant-based diets while reducing meat and dairy, or should it be to continue as it is, but focus on reducing greenhouse gas emissions from farm animals? To Manjot, how can health ministers or health ministries better engage on methane mitigation? And the second question to you is, what is the biggest obstacle to achieving the methane mitigation strategies outlined in each of the 3 industries mentioned today? Jenny, I have questions for you as well. For folks outside the health sector who have been working on methane, does the health intersection help make the advocacy case stronger? If yes, and in what ways? And the second question is, how can youth be mobilized in efforts to inform the public of the intersection of methane and health? And Gayatri, for you, a question is, what are the opportunities that can bring together the biggest health benefits to mitigating methane in your sector and what you presented? And I think I'll leave it at that because it's a lot of questions. So if there are additional ones, feel free to send them through the Slido, but we'll just stop with those. And if you want to answer in that order, Leanne online first.
Yeah, and we only have a little over 5 minutes, well, 5 minutes or so left for our session. So if you could maybe, no, we have, oh, fantastic. All right, we have plenty of time then. I'm so pleased. Okay, fantastic. So let's hear first from Leanne then on the questions that you were asked. I'm so relieved we're going to get to have time for these questions.
Absolutely. Thank you so much, and thanks to those in the audience that provided these questions. The questions I received went from broad to narrow, so just to reiterate, how can we integrate data on health-damaging air pollutants across the supply chain, emphasizing the need for climate-focused energy policies and to be able to maximize public health benefits. And so just to try to start off here, integrating these data really requires some additional information in order to be able to maximize the climate and health benefits here. But really this information centers around 3 of the points that I highlighted earlier. The first of which is the magnitude of the emission from a source. So to be able to really prioritize reducing methane or mitigating methane emissions and also reducing the co-pollutant emissions from these sources, focusing on super emitters and sources that are identified as having very high magnitude emissions would be really important. In addition to that, focusing on persistent sources that may be identified multiple times, maybe persistently leaking, would be really beneficial. The next component is identifying the location of a source and characterizing that location. So is that source located in close proximity to human populations? Is it located in a densely populated area? And what are the cumulative burdens faced by communities that are located surrounding that source? In addition to that, what do we know about the oil and gas basin or formation that that source may tap into? And the next piece is a bit more about source information, is the type of source. So where does this methane source fall within the supply chain? And understanding that will then influence our ability to link that with composition of health damaging air pollutant data, as the composition may vary throughout the supply chain. So that's briefly to try to answer that question. The second question that I received was focusing on public regulation in avoiding methane emissions from abandoned oil fields. And while I don't believe that I can speak to the effectiveness of these types of regulations really broadly, because they can vary by region, by nation, one really important issue raised here is how important it is that we pay attention to how oil and gas infrastructure is maintained and monitored over time, especially as we navigate energy transitions. It's really imperative that these sites continue to be monitored to ensure that we don't have emissions from infrastructure that may become outdated or may no longer be used actively. And this is important from an emissions perspective, but it's also critically important from a safety perspective to make sure that there aren't emissions that are occurring that could result in safety risks as well.
Thank you. Let's see, I think Vivian, you were up next.
If I got the question right, the question is, should we shift from livestock to plant-based? I'm rephrasing the question. Or should we retain the current consumption and then change the methane in the current consumption? Is that the question? Now, I would say I will always vote for transitioning, reducing our meat consumption towards plant-rich diets. Why do I say that? Remember, we don't just have goals for climate, we also have health goals. And evidence shows that excessive consumption of red meat has an impact on our health. So for me, rather than just, I would say, band-aid the problem, by just, bear in mind I'm using by just, which means there is room for multiple solutions. If all we are doing is just to band-aid it by reducing the methane emissions from animals whilst retaining the same consumption rates, then we stand a chance of having other issues, which includes health. But also, evidence shows that if we don't generally reduce our consumption, we're going to have a situation where some of these solutions will trigger other unintended consequences. For example, even with the seaweed, if we're at the rate of our consumption, the seaweed is not even enough to feed all the animals. That means we're going to start growing the seaweed, having other unintended consequences in the oceans. So what that means is that we need multiple solutions, reduce the amount, and then for the amount that remains, let's look for how to reduce emissions from that. Does that help? All right, thanks.
Thank you. And I think next we were going to go to Gayatri.
I also have one more question for Gayatri that came in. So if we want to maybe give it over to someone else so she can have some time to think about it. But the second question is, the community and kitchen composting units are good, but how is inorganic waste dealt with?
Okay, so let's go to Manjat while Gayatri thinks about that.
Great. I think there were two questions for me. So I think the first one, if I got that, was what are the current gaps in the strategies that can help us, or what are the gaps in preventing methane across the three sectors? So I think
Yes,
is that the one?
yes.
Okay. So I would say three major things, and they're not mutually exclusive. One builds on the other. One is the lack of accurate and up-to-date MRV data reporting and transparency of data. And I know that's not the end all. So, to give an example, most of the inventories we have, especially on, say, in the waste sector, are underestimating the methane from the waste emissions by at least 60%. And we know this because when we look at, say, satellite data or other forms of additional data monitoring, we're able to understand that actually most of our emissions are right now underreported. So we do need a suite of tools to measure, and I think we need to enhance our data quality so that that can really help in the right decision making and the action that needs to be taken. And tied to that is actually lack of good transparency, especially self-reporting from the oil and gas sector. And I think that's something we are pushing for at the Global Methane Hub, to have more accountability from the oil and gas sector so they can be more transparent and accurate in their reporting. And then I think data is just not sufficient when you talk to a public official who has been doing this work for a very long time and knows that it's not just what they see, but they already know that it's already enormous amount of methane coming from a landfill or from a coal mine or other sources. Sometimes data is not just enough. They're looking for solutions. So how do you connect the data with the right technical solutions and the right technical solution providers? Often in the Global South, we have entrenched incentives, and they're the same providers providing us the solutions that may not always work. So how do we ensure that the right technical providers and capacity builders are connected to those problems on the ground? And the third, as I mentioned, was in especially not so much the energy sector where you can fix the leaks and plug the gaps, but you can actually, in the waste and agriculture sector, solutions are not ready and off the shelf as much as the energy sector. So I would say we do need to invest more in tailored solutions for the waste sector and agriculture sector, which we at the Hub are also hoping to do more of.
The second question was on how health ministries can better engage on methane mitigation.
Sure. I think I can just provide recommendations, and I would love for colleagues who are at the WHO, CCAC, and other forums who've been engaging health ministries on this can speak more to it. But from my perspective, I think what we do need is a better intergovernmental coordination, right? When we even speak about putting in CO2 targets in NDCs, the Environment Ministry will have a different perspective, and the power industry or the power ministry or the trade ministry will have a different perspective, and they'll butt heads. So how do we make sure there's intergovernmental coordination so that health ministries are brought on the same table as the others who are making decisions about climate targets? So I think that's one. The second one, I think someone pointed out that making a better link, making sure that the health and climate data becomes a part of the air pollution data. And I think as the policymakers see that connection, they can ensure that health is not an afterthought. It's actually embedded in our climate policies and air pollution control policies. And I think the third would be champions at the subnational level, like Gayatri. Like, I think the work that you're doing as a official and who is also really looking at public health, the more champions we have at the subnational level and bring those stories for public awareness, I think we need more people like you and more stories from you.
Gayatri, your turn.
So what was the first question, actually?
What or where are the opportunities that can bring the biggest health benefits to mitigating methane?
Yeah. Okay, yeah. So I got it right. So, see, until very recently, methane was, no serious attention was given to methane, like the video that the short video that we showed here. And now we discuss it in a climate perspective, and with the WHO reports that clearly talks about health issues like respiratory issues and premature deaths, neonatal deaths. We started talking about methane in that perspective as well, like my friend told here. You know, bringing health and the health sector to the forefront in climate action, or along with the other sectors in climate action, is an important task that we have taken over now. And yes, we have to initiate local or ground-focused research with the health professionals to generate data for intervention, and that has to be done. And we lack, not only, we in the sense, not only Trivandrum or Kerala or India, but the whole of the world lack clear-cut data with regards to these emissions, with regards to waste, and that is something that we all have to work together on. And the next, one more thing to add to this is that, like she said, like we want to bring in health in this sector, and I am in charge of the health and sanitation of my city. So we have combined these two. So in the previous COP days, I was talking to somebody and she said in their country they have a separate wing for cleaning or sanitation and a separate thing for health. But we have this clubbed together, health and sanitation. I think that is more important, you know, looking at it in a different view. And the second question about inorganics, which I might, to explain, I might need another huge session from the WHO side, but I'll try to, you know, shorten it up a little. We have people called the Green Action Force. In the presentation at the beginning, the first slide, you might have seen women with green coats, right? So those are the people who work in the ground, who are mostly being called as waste pickers, but we would like to call them green technicians, because they are the ones who provide technical support to every household in managing and segregating their waste at source. Now we have this proper segregation at source of waste that is not only into organics and inorganics, but a thorough segregation in inorganics as well. That is used plastic, single-use plastics, then unwanted, plastics, and then, valuable products or valuable plastics, valuable wastes, other inorganics like leather, clothes, old bags, old clothes, etc., etc. So these are all, segregated separately and are collected at regular intervals by the municipality's Green Action Force and taken to a material collection facility where then it goes to the approved recyclers. So that is how we, systematically take care of the inorganics. And when it comes to inorganics, there's a lot more to talk about, like the waste pickers, the waste workers, their dignity has been improved massively through interventions like giving them uniforms and then giving them trainings as green technicians so that they can also provide technical support in organics waste composting. If you have a doubt, they come in. You can just call them. They'll come in and they'll teach you how to use the organic composting bins properly. So they've become health service providers more than waste pickers. And that is, all the spillovers from what I was talking about earlier. And this improved status of waste pickers, this behavioral change, and the campaign called My Waste, My Responsibility have all contributed towards organic as well as inorganic waste management. And our city is going to be declared as a zero waste city by next year, March 2024, and it will be the first city to be declared as such, which has practiced decentralized waste management recently. Thank you. Yeah. I think I addressed the question.
I just want to say congratulations for being the first, moving towards being the first zero waste city. That's quite impressive and really exciting. I'm going to keep my answer quite brief because then I want to give each of our speakers a last word before we close. So I'll take the first question, which is What do we see? Do we see the role of the health community making a difference, basically, in the methane effort? You know what my answer is going to be. I deeply believe in the value and power of the health voice to accelerate action on climate change, action on methane, and many other things. I think that we know that health professionals and people in the health community are trusted voices. We have the capacity to bring a combination of the evidence base and stories about the impacts on our patients or communities that can be very persuasive. And then with methane, as with other areas of climate change, there are real win-wins to be had here. The dietary changes that are being recommended to reduce methane, so increasing consumption of plants and reducing processed foods and meat, would have tremendous benefits in populations that are over-consuming those things. And similarly, reducing exposure to ground level ozone and to the toxic co-pollutants from methane would be hugely beneficial in reducing respiratory illness, cardiovascular disease, preterm birth, and things like that. And similarly, when we're talking about waste, poorly managed waste sites are such a burden on the communities around them. And so we can make the case for these win-wins. And as the health community, we really need to be a part of the conversation. Okay, we're going to close the session by giving each of our speakers 1 minute to share your final kind of closing words and call to action. What do you want to see folks take away from this, or call to action to decision makers, however you want to use that. And let's start as we did before with Leanne. What is your call to action?
We discussed earlier today, fossil fuels, coal, oil, and natural gas are responsible for the largest shares of energy-based methane emissions. And as other speakers noted, the sector is clearly connected in both simple and complex ways with the other sectors that we discussed today. And we know that gas leak throughout the oil and gas supply chain, from abandoned oil and gas wells, transmission pipelines, and kitchen stoves has been shown to contain not only methane, but also health-damaging air pollutants. And because of this, it's really imperative that we thoroughly understand and quickly address both the climate and the public health impacts of oil and gas sector leaks. And we know that gas composition data with detailed source-specific information on the health-damaging air pollutant fraction of natural gas can support evaluations of the air quality and public health benefits of emissions reduction efforts. And again, these efforts really should aim to prioritize super emitters and persistent sources of methane emissions, sources in close proximity to nearby human populations, and sources that are located within or directly adjacent to overburdened communities. So thorough evaluations of potential health benefits can further support the development of methane mitigation policies by further incentivizing and expanding support for these policies. And just on a quick note, I just want to express my gratitude one more time for being able to join in on this session virtually today, and my deep appreciation for the expanded focus on health and the increase in health voices at COP28. Thank you.
Thanks, Leanne. I think the health community is glad to be here in far greater numbers, and thanks again to you for joining us in the middle of what is middle of your night to share your thoughts. Okay, Vivian, last words, call to action.
Last words, like I said, our food system contributes 15% of total fossil fuels and 42% of total methane. So the solution is in there, right? But let's make sure that our solutions are hitting multiple goals. Goals of nutrition, goals of environment, goals of livelihoods. And generally, for all of us in the room, I want to believe we're among the privileged. Let's generally reduce the amount of meat we're eating and transition towards plant-rich diets. It's better for us. It's better for the planet. Thanks.
Fantastic, thank you. Gayatri.
So I don't want to take much time because she looks a little tensed. So I would just say that waste prevention or zero waste is the solution for zero emissions. And like I said, I really want you all to go through the environmental justice principles, which are just 5 easy principles that you can follow and bring it down to your cities. And environmental justice is very important, and it is what you need for the people and the planet we are living in.
Fantastic, thank you. And Manjot, you get the last word.
I'll be brief. So I think for the climate finance community, I think for us, it is to really, how do we hone in on the quick wins, the solutions that are already out there, but also invest in the systemic changes we need to see for the true transformation of our food, energy, and agriculture sector. And I think for us as a community, just raising more public awareness, all the great information we have already, how do we bring it? I think we have some ideas for the new year, what we can do together. But how do we bring those stories? How do we bring the links that are already mentioned in the reports that we probably will never get to because of our busy time? How do we use channels like podcasts and other ways to connect and get the information out there? So that's what I would say.
Fantastic. Well, could we get a round of applause for our fabulous speakers? And thank you to everyone in the audience for joining us for this. It's been a pleasure to be here with you.